The first time you are pregnant, most moms don't recognize the signs of labor, or they're worried that they're not going to recognize the signs of labor. There are many different signs of labor. You may or may not experience all of them. And some of the early signs are nesting, where you feel like you've got to get your house ready for labor. So you're undoing closets and getting things ready. You might have menstrual cramps. That's normal. You might also have leaking of a little bit of fluid. And if that happens, of course, you want to call your physician. Because although it's not maybe a sign of labor, it could mean that your water has broken and it might be time to come to the hospital. But really the two true signs of labor, the positive signs of labor, how you know you're really ready to go, is regular uterine contractions that get stronger and longer and start to become painful. Or if you get a gush of fluid, not like the leaking that you might get early, but a big gush of fluid is a good indication that you are in labor. When your water breaks, most moms are anxious and worried about it because of the way it's depicted on television. Their water breaks and all of a sudden they're in rip-roaring labor, and that's not usually how it happens. They're usually in labor first, and then their water breaks. So most moms have their water broken at the hospital. So when your water breaks, the best thing to do is to remember the time it happens, the amount of fluid, is it a big gush or is it just a leaking of fluid? The color, is it clear, is it blood tinged? Does it have a little green color to it? That's called meconium, which is okay, there's not a problem, we just need to know about it. And then the odor, it shouldn't have a foul odor. So the best time to come to the hospital is when your contractions are about 5 minutes apart, lasting for about a minute, and it's been going on for about an hour. That's a good indication that you're in good active labor and ready to come to the hospital. The bottom line is, everybody's labor is different, so everybody's going to experience different things. If you're not sure, go ahead and call your physician. They'll ask you a couple of questions and then either have you come to the hospital or reassure you that it's okay to stay home.